Introduction. Bone fracture repair is a procedure performed to heal broken or fractured bones using conservative or surgical treatment methods. The procedure mainly focuses on the reduction of the fracture and holding the fractured ends of the bone in the proper position during the healing process to ensure normal function after the fracture heals. Bone fractures may occur as a result of a fall, a direct blow to the bone, twisting injuries, wear and tear, and high-energy trauma such as sports injuries or motor vehicle accidents. The fracture may significantly limit your lifestyle and activities of daily living with accompanying signs and symptoms of severe pain, swelling, bruising, numbness, tingling, instability, bone deformity, and inability to bear weight or move the affected extremity. Indications for bone fracture repair. Bone fracture repair is recommended for the treatment of several types of fractures, such as transverse fracture. This type of fracture occurs along the bone shaft in a horizontal line pattern. Oblique fracture. In this type, the fracture occurs across the bone shaft in an angled line pattern. Spiral fracture. In this type, the fracture line surrounds the bone shaft and occurs as a result of a twisting force. Comminuted fracture. This type of fracture involves a splinter or break of bone into 3 or more pieces. Open fracture. Also known as a compound fracture, this type of fracture causes serious damage to the surrounding soft tissue structures, as the bone fragments stick out through the skin to the external air, exposing the fracture site. Stress fracture. Also called a hairline fracture, this fracture appears as small, thin cracks in the bone and occurs due to overuse or wear and tear. Preparation for bone fracture repair. In general, preoperative preparation for bone fracture repair may involve the following: a thorough history and physical examination, routine blood work and imaging, refraining from blood thinners, aspirin or NSAIDs, informing your doctor of any allergies to medications, anesthesia or latex, refraining from solids or liquids at least 8 hours prior to the procedure, arranging for someone to drive you home following the procedure, signing a consent form after the risks and benefits of the procedure have been explained. Procedures for bone fracture repair. Treatment for bone fractures will depend upon the severity and type of fracture and may involve any of the following treatment methods. Non-surgical method: casting and splinting. If the fracture is not too serious and the bone is correctly positioned, your physician may place the affected extremity in a cast or splint until the bone heals satisfactorily. Most bone fractures require the application of a cast or splint for 4 to 6 weeks, and sometimes even longer depending on the severity. Closed reduction. For severe angled fractures in which the bones have not broken through the skin, your doctor will gently manipulate and align the bones properly without the need for surgery. This procedure is called a closed reduction and is performed under local anesthesia to numb the area while the doctor manipulates the bones. Once the procedure is complete, a cast is applied to hold the bones in place while they heal. Surgical method. Surgical treatment is recommended for complex or open fractures and may involve the use of external fixation. In this procedure, metal pins or screws are placed into the bone below and above the site of the fracture. The screws and pins are secured to a rod outside the skin, which holds the bone in the correct position while they heal. Intramedullary nailing. During this procedure, a metal rod is placed into the central canal of the bone, passing across the fracture site. Both ends of the intramedullary nail are screwed to the bone to keep the bones and nail in proper position while the fracture heals. Plates and screws. In this procedure, the bone fragments are reduced or repositioned into their normal alignment and held together by metal plates and screws fixed to the outer surface of the bone. The plates and screws method is employed when intramedullary nailing is not a viable option. Postoperative care. After the surgery, Pain medications and antibiotics are prescribed to control pain and prevent infection. Your limb may be secured in a sling or cast. You will require the use of a brace and crutches until you are able to walk without assistance. Physical therapy exercises will be recommended to strengthen muscles and optimize limb function. You should refrain from strenuous and heavy lifting activities. Incision site care and bathing instructions will be provided. Complete healing of the fracture may take several weeks to several months, depending on the severity of the fracture. Risks and complications. Risks and complications of bone fracture repair may include infection, bleeding, blood clots, fracture malunion or non-union, persistent pain, hardware migration, hardware failure, damage to surrounding soft tissue structures. Summary. Bone fractures are common in athletes, active individuals, and people engaged in physical work, often resulting in severe pain and impaired mobility. The extent of an individual's injury and their compliance with their physician's recommendations will determine how quickly and how well the bone fracture heals. With suitable and timely intervention, most individuals are able to return to their normal activities and occupations without any functional limitations.